The trend line, well, it's not turning at all. 781 cases a day at the moment is what we're looking at. We have no reason to think that this will bend any time in the next couple of weeks. The government has determined there's not much more in the way of settings that it thinks will do a whole lot, or at least it doesn't think is achievable. What is coming into effect later this week are some more rules around authorised workers. They must have at least one dose of a vaccine to leave the LGA if they live in those LGAs of concern, or do rapid antigen testing at their workplace. That may have some effect on this because you'll have more and more authorised workers, the people most likely to be infected at the moment, or most likely to be transmitting this virus certainly at the moment. More and more of those having the protection of at least one dose of vaccine. So maybe that will have an effect in the coming weeks, but the bigger effect is from the broader scale vaccine program. And that means that when you're looking at a curve like this, when you're expecting those numbers to go up, lots more people are going to get infected. And I think it's really worth everyone in Sydney particularly really kind of understanding that a lot more people, thousands more people are going to get infected with this virus before the curve bends significantly. And so if you're someone that is holding out for a vaccine that you like the look of more than the one that's available to you at the moment, you really do need to balance that against the real risk that you do get infected at some point. That is really the calculation here. Vaccinations offer you protection and reduce the risk of you ending up in a position like this in hospital. Among the 645 people who are currently in hospital, among the 113 people now in intensive care, and 40 people on ventilators. All of those numbers have increased, including that one quite significantly today. Eventually, longer term, the idea is that this hospitalisation curve is sort of decoupled in large part from the case curve. We see a much fewer portion of the cases ending up here in hospital and eventually dying. We're starting to see that already. We have seen through this outbreak so far 76 deaths in New South Wales. That is down from the 120, 130 or so that we'd seen at the equivalent point in Victoria's second wave outbreak last year, and vaccines are a very large part of that. We really need to see that gap continue to widen. But, you know, that is the reality of the situation that we're in New South Wales at the moment. Thousands more people are going to get infected. Victoria still has some hope of bringing this thing under control, but it clearly is not a short, sharp lockdown anymore. And we've got another 45 cases today, so down from yesterday, down from the day before, but still a lot of the cases in the community while infectious, and still about 9 or 10 mystery cases that need to be investigated and worked through. And of course, this outbreak is now in a couple of fronts. We've got the Melbourne kind of clusters now. We've got cases in metropolitan Melbourne. They're most of the cases, but a growing number of cases in regional Victoria. This doesn't include today's cases. We haven't had a full LGA breakdown yet today, but we've got two fronts here, both of which are of some concern, and most of the mystery cases are still in Melbourne, spread across a wide range of suburbs. And finally, the ACT has, only 9 cases today. So that's down quite a lot from what we saw yesterday. A few of them out in the community while infectious, and a few of them still under investigation. So again, not a short, sharp lockdown this has turned out to be, but still a decent chance that one does come back down to zero. Whether that's by September the 2nd, I'm not sure, but hopefully sooner rather than later.
Absolutely. On to vaccination rates then, Casey. A couple of states and territories got to a 60% first dose rate yesterday. How far off 70% is Australia as a whole?
Yeah, well, look, Australia, different states will get there at different paces. Let's just take you to this chart. So 60.3% of first doses in New South Wales of the 16 plus population, 60.7% in the ACT. Both of those crossed over 60% yesterday. We haven't had today's update yet, but these two numbers, probably they're going to hit 70% sometime next week. That is how quickly these are kind of increasing. More than 1% of people on weekdays are getting a first dose. It's going to take quite a bit longer. And I just wanted to show you one other quick thing. This is the pace across each state and territory. So New South Wales now doing more than 100,000 doses a day. In most of the states and territories, these are made up of about 50-50 first and second doses. In New South Wales, we're seeing a massive surge in first doses, and that means the second dose number, well, that will start to surge up in the same trajectory we've just seen in New South Wales with first doses in a couple of weeks from now, and that's when we'll start to see the fully protected percentage of people kind of creep up and then start to shoot up towards 60, 70, 80%.